guys, has your pet been diagnosed with a kidney problem?
In this video, we're going to give you tools to help save your dog or cat from kidney disease. And those include diet, herbal supplements, acupuncture, and all aspects of holistic medicine. But the first thing I want you to do is hit that subscribe button. That really helps us out, and that keeps these videos going so that we can help so many more animals. Thanks so much, guys.
Years ago, we never really saw that many kidney problems in dogs, and now kind of we're seeing them all the time. And I want to know what you guys think about that. So that means that the creatinine would be elevated on your blood test. Normally it's around 1 to 1.5. And sometimes even when there's an elevation like 1.8, you know, now your veterinarian is telling you that there's a kidney problem. And sometimes they even diagnose kidney failure, which I think is kind of overdiagnosed, especially in the early phases.
They told me that she only had, she had less than 18 months to live.
They told you that? So,
Yeah.
okay, this is why we have to do this kidney thing, because it drives me insane.
And so
we've already exceeded that.
And so
Look at
we
us
have
doing so well.
We've done it.
Jeez.
And so I've gone to my acupuncturist for 20 plus years.
Yeah.
So when I got that news, I thought, well, we need to maybe look around. And we found you.
That was so great.
We use creatinine, we use an SDMA, it's a new IDEX level in the blood that we can check, and we use BUN, and BUN has a lot more to do with the proteins that the kidney is either filtering or not filtering. Our raw fed dogs have a higher BUN than normal. So BUN, creatinine, and SDMA, these are the things that we look at, as well as looking at the urine, seeing if the urine is dilute. How dilute is the urine? Are the kidneys concentrating the urine? Or, you know, is the animal kind of more peeing water, you know, because there's not enough concentration going on in the kidneys. Sometimes the only evidence of early kidney issues on like a young dog is that there's too much protein in the urine. Sometimes things that the body would filter through or resorb back, the body's not able to, so it'll all come kind of through in the urine.
And we wanted to test your urine.
Yes, we did. We wanted to test your urine because it tells us a lot. Does that make sense? Yes, because your pH was too high and we got to make sure it's not anymore.
We're looking at
I want vets to, if there's any vets watching this, I want them to look at pHs. pHs tell us a lot of the urine. We just want the urine pH to be normal. It's not a lot to ask for, huh?
The urine tells you a lot about the kidneys and what's happening or not happening. So we do, I recommend a lot of urinalyses here at the clinic. But what I wanted to talk to you guys about, and something that you maybe haven't heard before from even holistic veterinarians, and certainly in our holistic veterinary journals, nobody really talks about it, and that is early kidney disease is quite treatable. So I wanted to talk to you guys and just dive into that a little bit here, because I don't really feel like people are talking. It's almost like everyone's like, if it's liver disease, it'll get better, but if it's kidney disease, it's permanent and it'll never get better. And I guess I just don't think that's true, because that's not what I've seen clinically. So
we use this language that we use in Western medicine about the kidneys, right? We say, kidneys, are we in kidney failure? Are we in kidney dysfunction? What we really should probably say is that we're in kidney dysfunction, right? That the kidneys are just not operating optimally. But if we were actually in failure, then it would be like a lot worse, is what I'm thinking. And then kidney disease is actually some of the pathology in the kidney, you know, where the kidney is not resorbing back what it should be, in the way of it's not resorbing back the proteins that it should be. Normally the kidneys are so good at like sponging everything that the body needs back into the bloodstream.
Yeah.
But when the kidneys become into some type of dysfunction, they're just not as able to do that. So then sometimes you can see them spilling protein into their urine. And she hadn't done that much of that. It was like her protein spilling wasn't too bad. So we're just seeing this pH issue, which we do see sometimes. It was August of 2021, and she had a little bit low red blood cells, and that can happen with kidney issues too. And it's really easy to turn that one around with vitamin B12 into the acupuncture points for the kidney.
With that initial, what you mentioned, she had some red blood, would that also be part of what you were just talking about?
Not because, no, not usually. The blood doesn't go, the red blood cells don't go low in the bloodstream because of the urine spilling them out. But that's different. The kidney produces erythropoietin, and that goes to the bone marrow and says, hey, I want you to produce red blood cells. I want you to produce red blood cells. And then basically, if that erythropoietin is not doing that, then we will get some degree of anemia. But it's really reversible and treatable, at least at this level. It's not a severe situation, but when the vets see it, a lot of times they think, oh, we're in the kidney failure situation, and then they put you on the low protein diet, and sometimes that's the right thing to do, and sometimes it's just really maybe not the right thing to do. And so for her, we've actually not done that.
She's never varied in terms of her energy and her appetite or anything. I mean, it's always been, she's always been a pretty active gal, pretty happy.
Yeah.
Always wants to eat. So I credit you with that. So.
Oh, I don't know about that. But I do think we've arrested the kidney. I mean, her creatinine is better now than it was.
Yeah.
Was that 2 years ago now?
Yes, yeah.
Okay, so we're gonna do bladder 10. And then we're going to do, well, and I guess the other thing we can talk about too is she got injured, didn't she? She was limping and...
She was, and I think it's just, her best buddy is an 80-pound golden retriever, so twice her size. They play pretty hard.
That's right.
I think
but you also wanted to approach that naturally so that we wouldn't use a lot of medication, because one of the things about the kidneys is that we don't want to use a lot of NSAIDs. We don't want to go to the vet and get like every pain drug there ever was. We want to try to minimize medications, pharmaceutical medications, if we can.
Well, it was great. Like, I mean, I remember bringing her in. You were like, "Yep, I feel it," and then literally, she was fine. I mean,
that was a chiropractic.
Yeah,
like
that
she
got sort of an adjustment, and and we were doing, and also I was giving her arnica on your recommendation.
Yeah,
and it resolved itself really quickly.
Yeah, were we better? It was like a week or
less than.
Okay. Yeah, and so if people have a holistic vet that can do a chiropractic adjustment so that the dogs are not just thrown on medication because they're limping, it's huge. It's gonna, I call it pharmaceutical pressure, but it's the pressure that the pharmaceuticals place on the organs, on the liver and kidney. We want to try and minimize it. So if we can do something with acupuncture or chiropractic, that's what we want to try to do, or even homeopathy, anything like that.
We use an herbal formula that I've designed here at the clinic, and it's amazing. But basically, let's just kind of talk through the botanicals, and then we'll talk through the Chinese herbal botanicals. So the Western herbal botanicals, we might think of things like ashwagandha, nettle root. We might think of things like foti root and hydrangea root. These are really great medicines for the kidney, especially when it's in early kidney disease, right, you guys? Not if it's like end stage, obviously. Anyway, but they're very safe, and especially an herb like ashwagandha is so safe. Nettle root, very safe.
They're sitting right here in front of ashwagandha. So you guys, if you've been a client of mine for a while, you know about ashwagandha. I use it for a lot of things, and I'm just so excited to show you that this is the ashwagandha seed pod. Isn't it beautiful? It's red, and it's growing right here at the base of all these statues by this waterfall. And here's the seed pod. So inside the seed pod it's almost like it's in the tomato family, and you can tell, looking at it, looks like a little cherry tomato, all the seeds. And just look at where this is growing in the pathway. So we usually use the root, and I'll just go ahead and put this back in the ground. There we go. Ashwagandha is a powerful herb. It is used as a ginseng replacement, and it is used to strengthen the kidney qi. And in Chinese medicine, the kidney chi is the source of the essence of the body. Let's see, what else can I tell you about it? I guess we can kind of focus in on this is where the seed pod came from. It's just so beautiful. If you open up one of these, you should see the little red seed pod in there. Isn't that cool? And it's just so neat to be in India with this plant. There's another one. Because this is where it's from. It really goes to the bone marrow. And I always think of ashwagandha as this amazing plant that can actually go to the bone marrow and increase red blood cells, white blood cells. It's used a lot of times in addition to chemotherapy or to offset some of the side effects of bone suppression, bone marrow suppression.
Use Chinese herbs. So Chinese herbal formulas like Romania 8 has a little bit of aconite, a little bit of cinnamon in it. What does that do, especially in the old cats? It warms them up. In Chinese medicine, you know, their kidneys do not like to be cold. So actually this time of year, coming into the winter, that's when the kidneys are crying out a little bit, a lot of times, at least with our animal friends. I'm not sure about humans. So we use Romania 8, there's Romania 6. Romania 6 is a little bit more like for animals that are a little too hot. Maybe that cools them down a little bit. So maybe more of an autoimmune aspect to it. Maybe a younger animal might be more Romania 6. But you guys know in these Chinese formulas, Romania, especially cooked Romania, you guys know probably that we have raw Romania, we have cooked Romania, and they have different energetic properties. And I guess that gets me into a talk about just herbal medicine generally. Herbal medicine is complicated. Cooked Romania is what we often use for the kidneys because it's a little bit more heating, a little bit more nutrient for the kidneys. Raw Romania tends to be a little bit more cooling and maybe more for GI or other, sort of, I guess, symptomatic pictures. So when we're talking about the kidneys, you'll hear a lot about Romania, and I just wanted you guys to know. It's an herb I tried to grow in the garden, and it semi-failed. I was able to grow licorice really, really well. I got the Chinese licorice. If anybody wants some, I pull it out every year. So where we're looking at the energetics, right? We're looking at, is the pet too cold? This is very common in older animals. But now anymore, I'm seeing a 2-year-old dogs who have what you normally would have seen in an old cat. Their tongues, the back of their tongues are pale. Their pulses are very faint. And when you feel the tips of their ears and their feet, you guys can do this. Feel the tips of your animal's ears. Feel their feet. Are they cold? Are they hot? Even though your conventional vet may not understand, but you may say, hey, I watched this crazy vet on a video and she said the temperature of the animal and the energetic pattern of the animal is really important. That might open their eyes to the fact that there's this whole other world to treating pets, right? It's a world of chronic disease where we're trying to tonify organs, we're trying to feed organs, we're trying to use herbs that have an affinity towards those organs to heal them as best as possible. And no, we can't cure every animal, but it's amazing how many we can stabilize the creatinine, we can stabilize the BUN, we can stabilize the SDMA for a long time, sometimes years. You guys have seen some of those cases like Kayla and others that I'll probably post on this video. So then let's talk a little bit about the diet, okay? So diet here, we don't use KD, we don't use any kind of low protein, 24% protein, we don't do any of that. What I do generally is I have them on a similar diet that I have a lot of the dogs on, which tends to be 50 or 60% protein by volume, and then the rest really good quality organic vegetables. What vegetables feed the kidneys? Do you guys know what vegetables feed the kidneys? If you come to me, you do, because I talk about it. We use asparagus, we use parsley, we use carrot, and we use fennel bulb. These are all vegetables that have kidney affinity, especially that asparagus. And you guys, don't tell me you don't have time to cook for your pets. Some blanched asparagus and give it to them as a treat. You don't want to give the pet too much vegetables. Remember, we kind of wanted a 50-50 balance on protein versus vegetable. So if you give them asparagus as a treat, you just want to do, say, a single protein meat treat too, to balance it out, right? If we have too many vegetables, then we can throw our urine pH off. So we use real food to treat kidney disease. We use non-factory farm, no hormones, no antibiotics meat, ground meat, and we like cooked diets for the kidneys generally, except for that parsley. We love that parsley raw, so everything else is cooked. That means, you know, your carrot is cooked, your asparagus is cooked, your fennel bulb is steamed. And then we add calcium to balance it. We add a little bit of taurine to balance it. We might add our own vitamin mix. And then we add an omega source. What kind of omega-3s do you guys like? I tend to go for the plant-based omegas, so evening primrose oil, flax meal, flax oil, just use it up within 30 days. You can also use fish oil. The only time I will lower the protein is when a pet is severely azotemic. So what does this azotemic mean? It just means that the creatinine and the BUN have gotten so high that the poor pet is like swimming in his own toxins. And a lot of those toxins are the protein products that basically come out through BUN. When we measure the BUN, we measure how much protein is the pet eating and how much is the kidney doing or not doing. If the kidney is really in failure, really probably like end stage kind of failure, then we are lowering that protein a little bit because we're taking the pressure off the kidneys because they're so bad. But I almost never do that, and I'm not usually taking pets. I'm talking about a creatinine, non-dehydrated, so the dog is well hydrated and the creatinine is still over 4, then maybe over 4 or even over 5. And pets can live like that, especially if you're giving them fluid therapy at home. But a lot of times we do have to limit the protein in those situations. I want you guys to know what your dog's creatinine is, or your cat's creatinine. I don't want you to be one of these people like, oh, it's in the paperwork, I don't know what it was. No. You guys, you are holistic clients. That means that you guys know things, right? You're involved. You want to learn. You don't want to just leave it to the white coats, right? Or in this case, gray coats. Okay, so I want you guys to be involved, and that means you may have to cook for your pet. That means you may have to give them a botanical herb. You may have to go to a holistic vet. You may have to take matters into your own hands a little bit, and that's what holistic medicine does. It empowers you to do that. You still work with the veterinarians. You're nice to the veterinarians, even if you don't agree with everything they say, right? Because they're taught a certain way, and you have to understand it might not be the way that you're taught. That's certainly not the way that I'm talking right now. Acupuncture is excellent for kidney disease, you guys. Read my first book, Cat on a Hunger Strike. You will read about a cat named Nikita that basically was fed little frisky, so nothing good with the diet. But we did acupuncture every week or 2, and the cat lived 10 years without much problem. What do you guys think about treating kidney disease? What do you guys think about treating kidney failure?
So you guys, thanks. Subscribe, share, comment. Let me know what you think about Betsy.